Hey everyone, Dr. House with Outlook Chiropractic and Wellness in Grand Rapids, Michigan. I want to talk to you guys today about disc herniations. So some other similar terms that you may hear are a slip disc, a bulging disc, or a herniated disc. And there's different levels to disc injuries. So I'm going to explain what they all mean, how to fix them, and why they usually happen. So you have 24 movable vertebrae in your spine. In between each vertebra is a disc. Now this disc is, think of like a jelly-filled donut. The outside of it is a tough fibrous material that is much more durable. The inside is more of a jelly, more of a fluid. Now, a healthy disc is going to be nice and thick, and that disc stays healthy through movement of the vertebra. When each vertebra is moving correctly, that disc stays nice and healthy, hydrated. The thicker, the better. That leaves lots of room in those openings on each side for the nerves to come through. Now, when a vertebra gets stuck or fixated, it starts to cut off the hydration supply and the nutrient supply to that disc. So the disc starts to thin down and it becomes more vulnerable and susceptible to a disc injury. Now, the majority of disc injuries happen posteriorly, meaning that they push backwards. The reason being, we're always in a flexed position, so there's always stress on the back of that disc. Now, disc herniations don't typically happen to a perfectly healthy disc. It happens to a dehydrated disc that you've been setting it up for failure for a long time. So this is the importance of preventative care to keep those discs nice and healthy. Now, most disc injuries happen when somebody is bending forward to tie their shoes, pick up their laundry hamper. It's typically that bending motion where they're picking something up and twisting. That's when we see those disc injuries occurring. So a disc bulge is when that disc gets pushed backwards. It's not necessarily torn, but it's pushed backwards, sometimes causing some nerve irritation. This is not a surgical candidate. This is not a surgery case. These cases, these issues, they improve over time with just simple chiropractic care, exercises, with somebody who knows what they're doing, okay? Now, a disc herniation is much more severe. That is when that fibrous material on the outside actually tears and that jelly starts to push backwards. Now, like I said, it typically happens posteriorly, which is where those nerves come out. So the disc herniation will put pressure on the nerve and cause nerve irritation. That's when you start to see the numbness and tingling down the legs. Now, if this isn't addressed correctly and quickly, then you start to see weakness in those muscles. Over time, those muscles will start to atrophy or shrink or weaken because they're not getting the proper nerve supply to be using those muscles day in and day out. Now, the ways to prevent disc injuries are going to be through chiropractic care, through exercise, through movement, making sure you're staying hydrated and your spine is healthy. All right. Now, if you're somebody who has dealt with a disc injury, there's different levels. Sometimes surgery is the only option. However, once they cut you open, there is no turning back. Start conservative, start with something non-invasive that may prevent you from having surgery down the road. And chiropractic care is a great alternative to that. So first and foremost, we've got to get the joints of your spine moving. We got to reduce that joint dysfunction and get the inflammatory response down. So natural anti-inflammatories, turmeric, water, ice. You can also use some topical creams like BioFreeze over the area just to help kind of dull that nerve pain and reduce your pain a little bit and improve your function a little bit. That may allow us to do our job better and you'll benefit more from chiropractic care. Now, getting that joint moving and functional is going to be super, super important. Extension exercises are also good. So anything where you're leaning back, that's going to help pull that disc fluid back inside of that disc so that the fibers can now heal back together and reduce that nerve irritation. So what I want you to do is when you have an injury like this, you're just going to stand still, lean back to the point of discomfort. Once you feel that discomfort, you're going to stay in this position for 5 seconds. Lean back, hold it for 5 seconds, and then come back up to a neutral position. Then you're going to do it again. Lean back a little bit further. 5 seconds, come back up. Every time you should be able to do it a little bit further. That may help with an acute pain that you're feeling from the disc injury. Now, ice is going to help cool off that hot disc and get the inflammation down. So if you guys have any questions, if you are someone that suffers from a disc injury or you're fearful of sustaining or experiencing a disc injury, please let us know. We would love to help. We want to prevent these people from having to have surgeries. So Dr. House with Outlook Chiropractic and Wellness. Have a good day.